Well, good evening, everybody. I hope you're all having a great Wednesday evening. Here in Atlanta, it's starting to chill out, become a little more chilly than it has been. And I suspect most of the rest of the country is getting the same, doing in the same sort of weather. So I hope everybody's staying warm. Tonight, as you all probably know, I have a very special guest, Dr. John Foster. Dr. Foster is a physician in Jacksonville, Florida, and he does Social Security consultative evaluations. And so I thought he would be a really good resource for us to kind of learn about what consultative doctors do, mistakes to avoid, what they look for, things like that. So we obviously have a lot of questions here. Let me just start though. I'm going to start by asking Dr. Foster a few questions to kind of get things rolling. And then of course, if you have questions, we'll definitely take those. So first of all, Dr. Foster, thank you very much for taking your time to join me tonight. And I hope things are going well for you.
Yep, great. Thank you.
Absolutely, absolutely. Well, I guess let's start so people know, because again, I know a lot of folks have seen your YouTube channel, but if you would tell me a little bit about yourself, about how you got into doing consultative work, and kind of just some general background information, so people understand kind of where you're coming from as you approach this the task of doing consultatives.
Okay, so I'm a medical doctor, an MD. I started practicing medicine in 1979. I trained in family practice, but I found that emergency medicine was more interesting to me, so I did emergency medicine for 27 years. Got too old for it, did family practice, and have also been a ringside doctor for fighting sports. And I began doing consultative examinations in 2017 for the sole purpose of making some extra money. And I thought it would be very boring, and it turned out to be one of the wildest and craziest things I've ever done.
Huh.
And I've been doing it since then.
And I know before we got on, you told me a little bit that you were actually doing this originally to assist other doctors because, and this is one of the things I want to get into a little bit, so many doctors who are on the panels to do these consultative evaluations really haven't been trained how to do it. And from what I understand from what you told me, it's really a different mindset to do these consultatives as it would be to do regular type of treatment. If you could just kind of expand on that a little bit, that would be very helpful.
Sure. So the thrust of a consultative exam is, can this person work or not? What work-related abilities do they have? What don't they have? And what do they have but are limited? And how limited are they? That's completely different from the mindset of a typical doctor in a clinic or a hospital, who's mainly concerned about what is the diagnosis, what's causing the patient's problem, and what is the treatment, what can they do to relieve the patient's problem. And they rarely, if ever, think about whether the person can work.
Okay. Now tell me just again, because obviously the folks watching this are people that are either pursuing disability benefits or they have pursued disability benefits and are concerned about continuing disability reviews. So again, any one of the people here might be scheduled for a consultative. Let's start with the obvious question. What are the biggest mistakes you see that people make when they are going to when they receive that notice, you've been scheduled for a physical consultative evaluation? Start with that.
The first mistake is getting lost or not showing up. I've said over and over in my videos, make sure you know where the consultative exam will be located. Every single day I do consultative exams, I get at least one person calling the office lost. They can't find the office. And if you show up an hour or two late, you may have your exam or you may not. And if you don't, your disability application is going to be put on hold until you do. And that may take several months to reschedule it.
Yep.
So I even recommend doing a dry run on a day before your exam if you're not sure you know where the location is.
Yep. And I think especially with all the map apps we have, Waze and Google Maps and Apple Maps, there's really no reason at all not to know where it is. So I think that's a very, very good point. I know that when I did bankruptcy work for a number of years, and that was a real issue because we had these hearings that were scheduled on a half an hour, and it would drive me crazy. People would show up, you know, if let's say it was scheduled for 2 o'clock, they'd show up at 2:25, and the trustee in the bankruptcy case wouldn't hear the case. They'd have to reset it. We'd all have to come back down there. So absolutely. So again, folks, I think one of the things Dr. Foster is saying is that when you get that notice, look at the address. And let me add one comment to that. I've had situations where the person is scheduled for an exam 50, 75, 100 miles away. And if that should happen, and especially if you have a problem, let's say sitting in a car for that long, or it's going to be a real problem with transportation, in some cases, Social Security will provide transportation. Other cases, I've reached out to the adjudicator and say, look, my client can't drive or can't sit in a car for 2.5 hours to get to this exam in a big city. So not only should you know where it is, but look at the address and get a sense of how long it's going to take you there. If there's going to be a problem, let your attorney know or let the adjudicator know. So just my comments about that. So, okay, so one thing is obviously to know where you're going and to do a dry run and to be there on time, be there a little bit early. Okay, next issue.
The second thing is to describe why you can't work in your own words. People tend to want to talk about their diagnosis or their test results. Like they'll start off by saying, I have 2 herniated discs in their back, but they'll never explain how their back problems limit their ability to work. And always keep in mind, this is an exam to determine if you can work or not. So it's crucial to explain how your issues make it difficult for you to work. Okay. The next thing is to be specific. I commonly hear statements like, I can't lift very much, or I can't walk very far. But when I ask the person, how much can you lift, or how far can you walk, they don't know. And that's crucial for a CE exam to be able to give some sort of accurate figure. So if you don't know, I suggest that you find out before your CE exam.
So in other words, if, for example, you're going to be asked how long you can walk, to try to walk, see how long you can walk, right?
Exactly.
I've had people say, well, I don't know, I've never really tried. Well, you got to think about that because Social Security, that's the specifics, and that's the same advice I give to people prior to a hearing, is that you've got to know how long you can do various things and what your tolerances are. And I would take that a step further and say, don't think about this on the best day you're having, because everybody's going to have good days and bad days. Think about it to an average to slightly below average day. Think about this in terms of, could you do this activity, sitting, standing, walking, lifting, for weeks at a time? Not if you had a gun to your head, you had to do it in one day, but think about doing this over and over and over. Because again, as Dr. Foster says, this is about work capacity. The Social Security defines disability in terms of how your medical issues prevent you from engaging in what they call substantial gainful activity, which is simple entry-level work, not your past work, but really simple entry-level kind of work. And you really have to be able to be very, very specific about that. And so, again, as he indicates, think about that ahead of time. That time to think about that for the first time is not when you actually get to the doctor's office, because that's too late. You don't want to be, trying to make stuff up at that point. You really give it some thought. Take notes. Now, do people ever come in with notes where they've kind of, thought about some of these things and discuss?
Yes, they do, and that can be helpful.
Okay. What about if you mentioned somebody says, I have an MRI that shows herniated discs. Should somebody bring their MRI report? Should they bring the films to you? As a consultative doctor, do you want that? Okay.
No, we do not review records at the exam. We don't look at written records and we don't look at imaging studies.
Okay.
I tell people we talk and we do an exam. Make sure so you've sent all of your records to Social Security I remember you said in one of your videos, the number one reason that applications are denied is lack of medical records, but you don't need to bring your records to the exam. If you want to bring some notes to refresh your memory, that's fine.
But do not bring MRI reports. And again, this goes to the notion that you don't win a disability case based on a diagnosis. You may have a diagnosis
Correct.
of diabetes or herniated disc. That doesn't win your case. Now, again, at the listing level, it might be a relevant factor, but generally speaking, most of the cases that end up being developed are not going to be listing level cases. Let me ask you that. Do you see many cases that are listing level, or most of these not going to necessarily be at listing level?
Most are not, but some definitely are. And
Okay.
can you give me a minute? Keiichi,
Yes.
the wonder dog, needs some treats, or he's not going to be
Yeah,
quiet.
I heard that. Okay.
I'll be right back.
That's to take your time. I'll go ahead and answer some questions when we are, while we're waiting here. Okay. So RD, and I'm just going to go ahead and answer a few questions here. This says, I received a call as if they thought I was working. I'm on long-term disability, which probably explains the money. Will they refer a case back to the adjuster? Is that good or bad? I think the answer to that question is, generally speaking, RD, if Social Security sees earnings, money coming in on your earnings record, and again, the IRS shares information with Social Security, they're going to want to know what that means, what that's from. And if it's from long-term disability or the VA, you would need to provide proof of that so they see that you're not working. But they'll send it back to the adjudicator because, again, you don't want to get denied because you're receiving something that's not earned income. It's basically a disability policy or something like that. But that's, so they're looking to deny you, yes, if you're working, but if you're not working, you want to be able to explain that. So, okay. So all right, so let's get back to what we're talking about. So we're just discussing the idea that you don't want to bring documents in necessarily that the diagnosis does not make your case. It's really more about the functional limitations. And let's break that down a little bit more. We talked about sitting, standing. What are their functional issues? I mean, do you talk about crouching, crawling, kneeling, stooping, overhead reaching? How in depth do you get when you're talking to somebody?
For everybody, I describe their ability to see, hear, sit, stand, walk, lift, carry, speak, travel, understand, remember, concentrate, persist, interact socially, and adapt. That's what Social Security wants CE doctors to comment on. And so I go through each of those and indicate either they can do it without problems, or they can't do it, or they can do it, but they have difficulty, and how much difficulty they have.
Okay. And so it's a fairly comprehensive exam. How much time do you typically devote to one of these exams? How long do they normally take?
Half an hour.
Okay. So you're getting it's jam packed full of questions and answers. So again, folks watching, realize that doctors who do these consultative evaluations, I know you don't get paid a ton of money. You got to get to the heart of the matter. That is somebody's functional capacity, and you're going to ask very specific questions. And again, these are questions you really want to think about ahead of time. I've got, for my clients, I have videos that kind of talk about some of this stuff. But if you're doing this on your own, do your own due diligence. But again, you're going to be asked in a physical exam about really these are kind of a combination of activities of daily living and activities that would impact you in a work environment. Do you ever get in, and you said that some people are going to be listing level. How about the grid rules? Do you ever get into that? Is that something that
No, I don't get involved with the grid rules.
Okay.
Can I add a few more points?
Absolutely, please. Absolutely.
Okay, so another issue that I see is people think that the CE doctors have read their entire medical record, which may be more than 1,000 pages. And that's simply not the case. Before I do exams, Social Security sends what's called a CE packet. And that's a selected small amount of the person's medical record, which hopefully summarizes their problems. Sometimes it's very helpful, sometimes it's not so helpful, but I don't review the entire medical record. The other problem that I see is people, every day that I do disability exams, I usually find 2 or 3 people who have significant work-related limitations that they haven't even thought of or mentioned. I find that on the exam. Most commonly, long-standing problems with the shoulders or the fingers. And as you know, Social Security often adds up every limitation that a person has. So it's important to get every single limitation you have, even if you think it's minor, like a problem with one finger. And what I recommend is before your exam, just think about your whole body from the top of your head to the tip of your toes, and think about any problems you have that might limit your ability to work, and bring up all of them at your CE exam. Don't leave anything out.
Yeah, and I think sometimes, we people get so used to dealing with these problems. They've got a bad, like you said, a bad finger that they work around it, and so it's not really something they think of. But, if you've been at a job for 15 or 20 years, you may get accommodations, you build up a certain amount of goodwill. Imagine yourself at 50 years old, 55 years old, trying to go to another job where you have to show you can do certain things, and you've got a bad finger that limits your lifting or your dexterity with your dominant right hand. That would be very relevant. So again, I think what you're saying is you've got to think about those things, even the ones that maybe don't really impact you on a day-to-day basis at your existing job, but might at another job. So I think that's actually very, very good advice. Let me just jump in a couple of questions that have come in. And you're welcome, Kay Wolf, for we're happy to do this. And the question is, when looking at the grid rules and they say recent training, how recent? Well, first of all, Social Security now has a 5-year look back when it comes to past relevant work. So they're only going to look at 5 years from the date of your hearing on backwards. So if you did something, you had training as a nuclear physicist 10 years ago, that's not relevant. In fact, if your last job was more than 5 years ago, for Social Security purposes, you have no past relevant work. Also, and this is why, by the way, I think that people who they may have a master's degree or even beyond that, but it was from 20 years ago, it's probably not all that relevant. In my experience in the grid rules, education rarely is a factor there. Okay, please talk through about accommodations in a past workplace. Yes.
I have a question for you.
Yeah.
So I learned from your videos about the importance of education, and I ask everybody what's the highest level they've finished in education. Is it significant if they're less than grade school,
Yes.
less than high school?
Yeah, absolutely. Well, I think certainly in the grids, if you look at the grid rules, there are different categories: less than, very limited education, which would be less than high school, or of course illiterate. Then you have people that are high school or more. So it kind of breaks it down: high school or more, high school or less, or illiterate. And obviously somebody who has less of an education, is probably going to be limited to unskilled work. And for the grid purposes, when you're over age 50, it's a lot easier to fit into the grids if there's no transferable skills. And if you only have unskilled work capacity, there would be no transferable skills. So, some people say, well, Social Security punishes me for being educated. I wouldn't look at it that way. I think it's that they're, giving people who are less educated the benefit of the doubt, realizing those people would have a more difficult time entering into the workforce. But as a practical matter, I rarely see decisions or denials based on the fact that somebody has a college education or is highly educated, because many times the education or skills they've acquired are unique to their particular job or industry, or it's so long ago that it really wouldn't make any difference as far as their skills at work. So my experience has been education is really not a huge factor there. Now, I will say this. Sometimes people say to me, let's say, an extreme example, and I've had clients who are medical doctors. I've had clients who are engineers. And so, I will say, well, the issue in a disability case is, could you do any kind of job at all? Well, a medical doctor, an engineer, an orthodontist is not going to want to take a job putting ink pens in a box. But for Social Security purposes, if you can do that, you are not disabled. So one of the things that's really important for everybody to realize is for Social Security purposes, it's not about your capacity for past work. It's really about doing any kind of work at all. But again, education, in my experience, has not been a major factor. Not to say it couldn't be, but in my experience, it really has not been. I don't think judges feel like it's a major factor vocationally. Um, so, all right, so this question here, talk through accommodations at past work. Do you get into that at all? Do you ever talk to people about any accommodations they had at past work, or does past work even come up?
No, I usually don't talk about past work, and I never have asked about accommodations.
Okay, okay. And do people ever ask you at the end of an exam, what do you think? What are you going to say? Things like that? Or do they contact you afterwards asking for a copy of the report?
Well, at the beginning of the exam, I tell everyone that I don't make the final decision on their claim.
Okay.
People do ask for a copy of the report. I am not allowed to give a copy of the report directly. On the last page of the letter you get from Social Security telling you about your CE exam, there is a form for you to fill out and have your doctor sign, and Social Security will send a copy of the CE report to your doctor, and then you can get it from your doctor. But
Okay.
I can't give it to
Can't
people
provide it to you.
directly.
And I will say this, as the attorney, I have access now, and this is fairly recent. We have access really even at the beginning stages of a case. So I can get copies of those CE reports, usually within a few days after they're posted. So many times my client will ask for a copy and I will provide a copy. Because again, I think it's relevant to what they do, but it's certainly not, again, I think you made this pretty clear, but you're not taking sides here. You're trying to be an objective, evaluator as far as what the person's limitations are. And, do people ever reach out to you and try to argue with you or try to complain about what you said? Or is it people understand this is kind of a one-time, really more of an objective type of thing?
No, I've never had anybody reach out to me after an exam. I do occasionally see people twice, and that's if their first application has been denied. Social Security may send them back, usually after about a year, if they've reapplied for another exam.
Okay.
But that's a small minority of
Yeah.
folks.
Now I have seen that where the consultative evaluations, it'll again, like you said, a year and a half later, they'll go back to the same doctor. And I'm assuming, many times it's a very similar report, but sometimes things have changed, and that would make a real difference in the case. Now I will say this from my perspective. I don't think that what a doctor says in a consultative evaluation, is generally going to be enough to move the meter to win a case. I think you need to have your own medical, treatment, your own doctor's reports, treatment records, because one of the things that Social Security does talk about is something called a longitudinal treatment record, where they want to see ongoing treatment. And to correct me if I'm wrong, the consultative exam is part of Social Security's obligation to develop the record. So that it gives the adjudicator some sort of a sense of the person's functional limitations, and also because many doctors, treating doctors, as you pointed out before, they're not focusing on assessments of capacity. They're focusing on treating you, and developing a diagnosis and treatment as opposed to functional limitations. So this serves that need. But for all those out there, don't apply thinking you're going to go to a consultative evaluation and that's going to be enough, because usually it is not, again, from my perspective. Do you know anything? Go ahead. No, please.
From what I understand, Social Security sends people to consultative examinations usually because their medical records are insufficient to make a determination. And that's often because the person has lost health insurance,
Yep.
lost their job, and hasn't been able to go to the doctor regularly. And sometimes it's because the medical records are confusing or conflicting. I've gone through records on people that I was going to see and couldn't figure out what the heck was wrong with them just from looking at their records.
No, well, I spoke to a client yesterday or today. I think it was, I can't remember. The names kind of run together. But this person had two fusions, and just from a very, very significant back problem. And the consultant or the Social Security adjudicator sent this person out to a psych consult, but not to a physical medicine consult. And they asked me, why is that? I said, well, because I suspect that the record is sufficient for the physical medicine, that's really not an issue. I mean, you've had two fusions, you've got significant problems. There was a I can't remember what she called it. Was like a substance that was used to, like, there was a crack in the in the vertebra, and so they used something to kind of I guess secure the fusion, and that caused bone overgrowth, which required additional surgery. I mean, this person's a real mess as far as the physical part of it, but I suspect that Social Security saw something in the record or assumed there would be some sort of a level of depression, anxiety that would, possibly even help in terms of a grid rule argument because of the non-exertional part of the, eliminating transferable skills and so forth. So that's why they did that. But yeah, you don't always see consultatives. They will send people out for them, but not every single time. Do you know?
That brings up an important point, which is the purpose of consultative exams is primarily for physical problems. And Social Security also has psychological evaluations, which are done by psychologists or psychiatrists
Right.
for mental health problems. Many people have both physical and mental health problems combined. And in that case, I tell them that I deal with the physical.
Yep.
And often I will recommend that they get a psychological evaluation. However, if somebody is clearly mentally ill, displays obvious signs of mental illness, I will put that in my report.
Yep.
Most recent being a man who was hallucinating, hearing voices while he was in the office with
Wow.
me.
Yeah. Well, the consultative evaluations, again, many people get both a physical and a mental health one. Again, the mental health ones would be a psychologist, sometimes a psychiatrist. Again, if it's a, organic mental health problem, if it's schizophrenia, if it's something, traumatic brain injury, it might be a neuropsych evaluation. And again, those can be very, very helpful in identifying things, because I find, again, just my experience, that sometimes the psychological records of the doctors, that the psychologists that treat people, can be handwritten notes. They don't really say a whole lot in terms of functioning. And, maybe the doctor will complete a functional capacity evaluation, but the psych CE, we call them psych CEs, can be very, very helpful in that regard. And again, the medical CEs, can really sometimes put the functional limitations really to the front, to the fore, so that it can really be something that we can work with.
Can I give an example of a confusing
Absolutely.
record?
Yeah.
So I reviewed the records of a person who was claiming disability for blindness, and they'd seen 3 eye specialists. 2 of them had said that both of their eyes were legally blind. One of them had said that one eye was legally blind, but the other eye was just under the limit for legal blindness. So they were sent to me, and when we checked them, we had our eye chart on a filing cabinet, and the person couldn't even differentiate the eye chart from the filing cabinet. So I just put in my report that this patient is blind in both eyes. And I think that solved his problem.
Yep. Well, I will tell you that, vision is one of the interesting areas with Social Security, because if you look at the vision listing, one of them talks about you have to have worse than 2200 in the better eye. or there's other visual limitations, but it's very, very extreme to meet the listing. And if you don't meet the listing, you have significantly impaired vision that's not correctable. You got to have something else. So, I've had people that have come through my office where they have, let's say, 2150 or 2100, even with correction, which is pretty bad, but they don't have anything else. That's going to be a hard case to win. Not every time. It can be winnable, but presumably there are jobs out there. And realize what I'm looking at is through the lens of, can this person do any kind of work at all? So I'm looking at everything through the lens of work capacity. And there are jobs out there that you can do with very, very limited visual acuity. And vocational witnesses at hearings, we talk about this, in my videos and elsewhere in the live stream, is, almost every hearing, the judge will have a vocational expert, somebody with knowledge about what employers will tolerate and actually specific jobs that exist. And so the judge will offer a hypothetical question to the vocational witness. Mr. Vocational Witness, I want you to assume a hypothetical person the same age, education, work experience as our claimant. I want you to assume further this person is limited to light work with the following limitations. Then the judge might go to that consultative evaluation, the limitations described. This person, needs help, let's say cannot stand for more than 15 or 20 minutes, can only sit for 10 or 15 minutes, has difficulty with overhead reaching with the right dominant arm, so there should be no jobs requiring that, et cetera, et cetera. And, can this person return to past work? Are there any other jobs this person can do? And that's what happens at a hearing. So again, just to put the emphasis on it, the specific vocational limitations are very, very, very important in a disability case. Do you have any tests? I mean, one of the things that sometimes you see coming up in these exams is it's a really bad word for disability attorneys to hear, malingering or secondary gain, drug-seeking behavior. I'm assuming that there are ways that you test for something like that.
Yeah, I was going to bring that up.
Yep.
The absolute worst mistake a person can make at their CE exam is to exaggerate or pretend. It's extraordinarily difficult to fake a disease effectively. Many of the things that people imagine someone with a condition would have are counterintuitive. They're the opposite of what a person with that condition actually has. And what's really frustrating for me, if somebody's just pretending the whole thing, that's easy.
Mm-hmm.
But when somebody actually does have evidence of a disease, but they're also exaggerating their problems a lot, there is no way for me to tell what's real and what isn't. And I put that in the report.
Yep. Well, I think that, that's a very good point, because I tell this to people, and really a lot of the things that Dr. Foster is telling us are the same things that you need to know in preparation for your hearing. Try to stay away from extremes. I can't do anything at all. I can't lift more than 1 pound. I can't sit for more than 5 minutes. I mean, some of these things are very, very hard to accept, that you can't do anything at all. And I think when you talk with, absolutes, nothing, I can't lift anything, I can't do anything at all. Judges aren't going to believe it either. And the problem is, again, from my perspective, if there's a medical record, whether it's your treating doctor or a consultative doctor, if you start seeing things like symptom exaggeration, secondary gain, meaning they're trying to get on disability, drug-seeking behavior, that will torpedo a disability case. Judges get very suspicious about it. And they'll tell you that there is a narrative in the United States Congress, unfair as it may be, but there is a narrative that a significant portion of people pursuing disability benefits are exaggerating or outright faking. I will tell you, after doing this for 35 years, that is not the case. However, that is the narrative. And so, for some judges, if they get the sense that there may be some of that going on, it's a real problem. So the point I think Dr. Foster is making, and I just want to re-emphasize it, is, think about what your limitations are, but try to stay away from absolutes. I can't do anything. I can't stand at all. I can't lift at all. That's really not going to help you very much.
The flip side of that is I think the doctor has to be very careful and very certain before they indicate in the report that the person's pretending or exaggerating. And in my videos, I've discussed this. I like to see at least 3 indications, and preferably more than 3. If there's just one indication, I don't think that's enough to put into somebody's report that they're exaggerating or pretending.
What about the flip side of that? I've had clients who are tough guys. I mean, people that just work through extraordinary pain, high pain tolerance. They just, their identity is, usually it's a man, but it can be a woman. I am a, warehouse supervisor. I'm a forklift driver. Do you see that where people are maybe minimizing the extent of their limitations?
When I started doing the job, I was very alarmed by seeing people actually injure themselves during the exam. And they typically be your tough guys who hate being disabled. So when I test things like their range of motion or their strength, they'd force themselves to do things that were very painful. So now, when I get someone like that, before I start testing them, I tell them, listen, Social Security wants to know what you could do reasonably comfortably over an 8-hour day, not what you can force yourself to do, and then you'd be in so much pain you'd have to go home and lie down for the rest of the day. So if anything you're doing hurts a lot, just stop and let me know. And once I started telling people that, they started injuring themselves during their CE exams. There is this notion, and I get this in my comments, that people can be in god awful pain and walk around with a smile on their face. And I believe the people who believe that have never experienced severe pain. I have never seen a woman in childbirth without anesthesia smiling.
Mm-hmm.
Likewise, I've never seen a man passing a kidney stone without any analgesia smiling either.
Yeah. Well, I think that, I read someplace that the CDC says, I think it's something like 17% of the US population lives with chronic pain, and maybe
That's
8 or 9.
nonsense. Every adult has pain every
Yep.
day.
But the level of debilitating pain, the pain that would stop somebody from working. That's yeah. That was the point.
That's nonsense promoted by people who want to make money off of pain.
Interesting. Okay. Interesting. And as far as, well, let me ask you this, because one of the things I see as well is for certain types of medical conditions, back pain, for example, there tends to be sort of a protocol. You go to the doctor, the doctor may prescribe rest, the doctor may prescribe, I don't know, ice, physical therapy, epidural injections, facet injections, and then they go for a surgical consult. Do you ever get into that kind of what the person has gone through in terms of the treatment that has been offered to them, to get a sense of, is this a serious type of medical issue? Because again, if you don't have the MRIs, you don't have the tests in front of you, do you talk about history at all, or is that just something that's really beyond the purview?
A little bit, but you need to keep in mind that what Social Security wants the focus to be is what sort of shape is the person in now, not what they've gone through in the past. So I will briefly get the history of this treatments, but again, the focus is what sort of work-related abilities and limitations do they have now?
So you're taking a snapshot. In other words, you're not looking at this in terms, and that's really, as the attorney, I'm trying to paint a picture more of a long-term, progression of what's going on. You're taking a snapshot. So that snapshot is something that I use as at this moment in time, March 3rd, 2024, this is what was going on with this person. And it may have changed or it may not have changed. And maybe it was different 6 months before, but that's what the snapshot is. Like, well, that kind of makes sense.
And I haven't seen that person over a longitudinal
Right.
period of time.
Correct. Something else you hear about consultative evaluations. Do doctors look at people in the waiting room? Do they look at people coming in, from the parking lot to see how they're walking, to see what they're doing, and compare that to their, how they present themselves in the exam?
Doctors look, hear, and smell everything all the time related to a patient.
Okay. So, I tell my clients, of course, at the end of the day, something you said before, you're not going to fool a trained eye. I mean, if a doctor is going to be able to tell if you're making something up, if you're exaggerating, because again, it's just you have a lot of years of experience. You're going to figure that out. The point I'm making about the waiting room and the parking lot is, if you walk in, from the parking lot, if you're in the waiting room and you are not limping, you have no limitations, then you walk into the exam room and and you're dragging a foot, that's going to get noted in the report and that's going to hurt you. So again, you want to just be truthful. I mean, I don't think that none of us, myself, nobody's going to be able to fool doctors on an ongoing basis, and you shouldn't try, because Social Security is hard enough to do it, but nobody's that good of an actor, or if there are any, I haven't met them yet.
And like you say, that's a small percentage
Yep.
of patients, but I definitely see them. Here's a really good example. I had a no-show, so I had a little free time. So I went up to the front of the office, which had a window that looked on the parking lot. And I saw two men pull up in a pickup truck, and one man got out, took his T-shirt off, which involved raising his hands high over his head. Then, for some reason, he put his T-shirt back on, again raising his arms high over his head. And then he took it off and put it back on again. Then he came in the office for his CE exam, and I asked him to show how high he could raise his arms over his head. He acted like he couldn't raise them any higher than that.
Yeah. No,
What would be your conclusion?
Right. It's certainly an exaggeration, and yeah, that just isn't going to help. Isn't going to help. And people say to me, "Well, does Social Security send out investigators?" And they don't. I mean, generally, unless there's a reason for it, they don't send out private investigators to evaluate disability claims. The only time I've ever seen it happen would be if there's some sort of allegation of fraud, especially for somebody who's been approved and there's a reason for it. They do have an investigative branch, but usually they don't. But they rely on the CE doctors. They rely on the people, the adjudicators, to kind of sense that going on, and it'll get noted. But again, it is the kiss of death. If you start seeing the words like malingering or drug-seeking behavior, secondary gain, it's just again, nobody's smart enough to fool a lot of people. It's just not likely to happen there.
Like I say, just describe your problems, how they limit your ability to work, and be honest about it, and you'll have no problem.
Gerard Bowers asks, do all applicants have a CE, or only those with medical records are incomplete or inconsistent? Good question. I would say that it's really up to the adjudicator, the person, that the claims analyst at Social Security. They make the decision about who they're going to send out for a consultative evaluation. Honestly, sometimes there's no rhyme or reason to it. Some adjudicators send out everybody to both a physical and a mental health consultatives. Others do it more selectively. I've had cases, and it's not that uncommon, where at a hearing, the judge keeps the record open and says, I'm going to send this person out for a consultative evaluation to get a sense of their functional capacity. So, I think that it's a fair, I would say, rough percentage, 85% of the cases that I'm representing people, there's a consultative evaluation, at least one in it. So it's pretty common there, pretty common. All right, so Sharon asks us, how can a doctor like Dr. Foster discern the limitations without reading the underlying medical record? So how would you answer that?
Well, first, the underlying medical record rarely has work-related limitations in it.
Okay.
Second, I already mentioned the ability to raise arms overhead. I don't need to review a record to assess that. I just ask the patient to raise your arms up like this, and either they can do it or they can't.
Okay. Okay. Again, that's that snapshot issue there. Okay. So again, I think Sharon, what he's saying is that he's looking at your capacity based on the tests that are being done, and at that moment, that's his assessment of what your capacities might be. This is not intended to be a historical document or showing a narrative of your injuries over time. That's what I do. So, okay, James. I know James, you sent me a couple of comments here. You're crippled by way of work and have worked your whole life. You're 60. Can I get more for my injuries that are massive? All right. So let's just talk about that very briefly. First of all, with Social Security, the amount that you get is a function of what you have paid in. So you don't get more money because your injuries are more severe. Sometimes somebody says to me, I got approved because I have a back injury. Now I have developed uncontrolled diabetes. Now I've developed, knee injuries. Can I get more money? The answer is no. It is a function of what you have paid in, and there's a calculation that they do. It doesn't depend on your age either. So, turning 59 to 60 does not entitle you to more money. So, massive injuries with Social Security, it's either you're disabled or you're not like the VA, where the VA has percentages. Social Security is you are or you're not disabled. So once you pass that threshold to get approved, then you're approved. The amount of money you get is a function of what you have paid in. There is something called a PIA, which I'm not going to go into here, primary insurance amount, which is basically a number representing what you've paid in. There's something called a family max that would determine how much you're going to get, as well as your any dependents that you might have. But that is not a number that is a function of the nature of your injury. So I hope that answered that question for you. Okay, let's see here. All right, here's a question, and this is kind of interesting about telehealth. Did you ever do any telehealth evaluations during the COVID pandemic, or have you always been doing them in person?
I've always done them in person. They shut down all CE exams where I am from mid-March through August of 2020.
Okay.
And I really don't think a CE exam can be done properly by telehealth. Psychological evaluation maybe, but not a physical exam.
Okay. Now, what do you say? I've had people say things to me like, I went into the doctor, for the consultative. It lasted 10 minutes. The doctor did not touch me, didn't do any kind of test, didn't, hit my knee to check my reflexes, and wrote this report. What am I, first of all, is that, I assume that's not an acceptable level of evaluation for a consultative evaluation. And the second part would be, what are the recourse, which is more in my realm. But I'm assuming that there's a certain minimum standard that you would expect a doctor to do for a CE, correct?
Correct.
Yeah.
And if the person hasn't even been touched, they haven't had an adequate CE, and I would recommend that they contact Social Security and request another exam with a different doctor.
Okay. Or, if you're represented, contact your lawyer. And, what I tell people to do is after your exam, really take notes of what happened, figure out how much time it took. And if the exam was not comprehensive enough and there are conclusions or statements in the report that are inconsistent with what happened, as Dr. Foster says, you can request another exam. They may not do it. Or B, what I would do is at a hearing, I would ask the judge to give that consultative exam less weight because it's not accurate, it's not appropriate, not fair. And sometimes judges will do that. But again, you need to be able to, I tell my clients, after your exam, write down everything you can remember about what happened. And, we may need to go back to that and may need to challenge it because, look, sometimes the consultative reports, describe a level of capacity that, you disagree with, and other records would say otherwise. And so we have to get past that. So that's what again, that's what lawyers are
At a very bare minimum, the consultative exam should involve examining the areas of the body that you've mentioned are a problem. And I always do that, and I always do a screening head to toe exam. And like I said, I frequently doing that find problems that the person hasn't even mentioned.
Yep. Well, again, that's because people don't necessarily think about a particular problem as being work preclusive, but it can be. So I think what the big picture here is for consultative evaluations, and again, my opinion is that treating doctors, that those reports are going to carry a lot of weight with the judge, but that some judges, under the law, a judge can rely on a consultative evaluation to make a decision in a case. So you want to be prepared for this. And this is one of these things where you've got to prepare for it. You can't just go in there and try to wing it. You want to really think about it. I tell my clients, you want to sort of have a narrative in mind. I call it an elevator speech. One of my videos talks about having an elevator speech where you can describe very succinctly in 2 or 3 or 4 sentences what's wrong with you. And then beyond that, talk about your specific limitations, but think about it ahead of time. You really, really have to.
That's really good advice.
Yep. Okay. Let's see on the subsidy. I'm not sure if I understand what you're asking me. The subsidy feature. How can beneficiaries at work take advantage of this, get approved? Not really sure. Okay. Our Sharon says he should be doing an objective functional capacity evaluation. My response to that, Sharon, is there are there are physical therapists who will do thorough, multi-day sometimes functional capacity evaluations. That's not what a CE, correct me if I'm wrong, that's not going to happen in a CE. You're not going to do, 2 days of testing where you're, being tested on weights and things like that. It's just, they don't pay you enough, and that's not really what this is for, correct? I mean, this is, if somebody wants a more thorough functional capacity evaluation, you got to go to a physical therapist, I'm guessing, right? That would be.
Yep.
Yep. Okay.
The most thorough medical exam I've ever heard was the medical exams for the Apollo astronauts. They were near Olympic level fitness.
Yep.
When they were selected, they underwent 1 full week of examination by doctors in every specialty. And they still missed a serious medical condition that almost scrubbed a mission when the person was in space. So there's no such thing as a medical exam that can rule out every problem.
Yep. Yeah. Now I remember that there was somebody, I forget what the issue was. Was it Slayton?
A heart problem.
Heart murmur or something like that. I think it was Deke Slayton who was who I think eventually got into space, but he was scrubbed quite a bit. So all right, here's a question. Let me ask you this: Do you ask people to undress, or are they basically, when you're evaluating them, they're fully clothed? Tell me about that.
Usually not, unless it's something I absolutely need to see with the clothes off. I recommend that people, when they go to their CE exam, wear clothes that are easy to examine in. If it's in the summer, a t-shirt, shorts, and sandals that can be removed. If it's in the winter, sweatshirt and sweatpants. Please don't wear construction boots that take 15 minutes to take off and put back on, because frequently I have to see people's feet, which involves getting the shoes and socks. If every once in a while I have a female who needs a sensitive part of their body examined, and I always tell them that that's optional, but it will help their claim if I can see the problem, and I bring in the female medical assistant when I do that. And interestingly enough, I explain it that way. I've never had a female refuse.
Yeah,
An example would be a woman who'd had breast cancer surgery, and it was over a year since her surgery, and her surgical wound just would not heal, and she had a big open wound on her chest where the breast was removed.
Yeah. One thing that I find in what I do is, people talk about, or they have medical issues that are, obviously sometimes quite embarrassing, people with, irritable bowel disease or, things like that, or they have problems with, excessive urination, or they can't control it. And, at a hearing, it's really a little bit awkward because you're in a hearing with a bunch of strangers, and again, most of these are done by video or a phone. But obviously, I'm a male. If the judge may be a male, the vocational witness may be a male. You're talking about some very embarrassing, sensitive things with a bunch of strangers, and it's not an easy thing to do. But again, for disability purposes, you've got to paint the full picture. You can't leave something out. Which actually is another issue that I run into sometimes. I've had people say to me, well, I don't want to talk about that. That's not relevant. Well, in a Social Security world, you don't get to decide what's relevant or not. It's really Social Security gets to decide that, and you can't leave things out. So if there's a medical issue, if there's medical treatment you've had, surgeries or treatment for, again, maybe you've got a really bad back, but you've been treated for depression or suicide attempts or something like that. You can't just leave that out. You've got to reveal all that stuff. And if you're applying for disability, you got to be prepared to do that. Do you ever have that issue where people just don't want to talk about something and just refuse to discuss
Not
it?
really. And interestingly, I learned from one of your videos about the importance of frequent bathroom breaks for disability. So now when I do get somebody with a bladder or colon problem, I explain to them that frequent bathroom breaks are important. And then I ask them how often do they have to go, and when they have to go, do they have to go right away, or can they wait? One other point I want to bring up is occasionally I will get a female with a gynecological problem, and we do not do pelvic exams at CE exams. So if you do have a disabling gynecological problem, see a gynecologist and get a pelvic exam in your record, because it won't be done at the CE exam.
Yep. Yep. And what Social Security could do in theory is they could send you out for a gynecological exam with a gynecologist. It's rare. Now, again, it does happen sometimes. I do see, again, neuropsych evaluations. I'll see cardiac evaluation specialists, but usually it's pretty rare you see Social Security sending somebody out to a specialist. I guess the argument being that if you are applying for disability and you have a unusual problem, one that requires a specialist, you're probably treating with a specialist, and that's going to really be the more relevant evidence. But occasionally they will, and again, I do see it with cardiac issues. I do see it with occasionally an endocrinologist for diabetes, things like that. Actually, diabetes is another condition that I've had people, and so a couple of folks have talked about this. They can't afford medication. So I assume that would be something that you would talk about in the exam, that the person has, out of control blood sugar, that their A1C is way too high, but they can't afford, the insulin or the medications. What do you do in that situation? Is that something
I put it in the record. It's really awful to see some of these folks. Like I said, they've lost their job, and when they lost their job, because of medical problems, they lose their medical insurance, and now they're sick or they're injured. They don't have any money. They can't get medical care. Quite a few of them can't afford their medications. These people can really be in a bad way.
Yep. Well, I think that, one of the things that, of course, everybody's really concerned about is the long delays in the Social Security claim processing. And I tell people, at the initial application stage, assume 8 to 12 months. If you happen to be in Texas Texas or Florida, could be longer. Some states are really, really bad. In fact, I just saw some statistics the other day that the delays are getting really, really long again because the staffing issues at Social Security. So you're going to probably wait close to a year for an initial decision. Sometimes they don't even assign the case to an adjudicator for 4 or 5 months. So it could be a year. Again, how do you survive? I can't answer that question, but how do you survive for a year waiting for Social Security to make a decision? Then they turn you down. You probably recon the first appeal. You're going to wait another 7, 8, 9, 10 months, sometimes longer. Then you request a hearing. I'm doing hearings now that the person filed two and a half years ago, sometimes longer. So there is a real practical issue in the Social Security disability world: is can you survive for, a year and a half, 2 years before you get awarded, if you get awarded at all. And there's also the issue of, you have some judges who don't seem to understand that disability. You don't have to be in a coffin to get disability. So there's a real practical issue of, how do I survive for 2 years waiting for Social Security to make a decision on my case? And you can't assume it's going to be a favorable decision. Obviously, you hope it is, but this type of issue of people not affording their medication, and of course their conditions just getting worse when they can't afford their medication, it's a real issue. And you see it obviously in the consultatives, where somebody comes in and they can't afford, whether it's medication for, again, diabetes or something else, or it's pain medication, and there's just a lot of suffering out there, a lot of suffering out there. And I wish that, and I know that some of the people, the commissioner of Social Security, by the way, is his name is Martin O'Malley. He just resigned. He was going to be out of a job at the beginning of the year anyway, but he just resigned, I think effective at the end of this month, to take a job, or to try to become the chair of the Democrat National Committee. So we're going to be without a commissioner, until Mr. Trump appoints one, and then they've got to get approved. So, we're kind of back in that limbo world where there's really nobody kind of minding the store. So it's not going to get better before it gets worse. I mean, I'm just going to tell you that. It's just not a good situation at all.
The last section of my report, it asks for my recommendations.
Yep.
And quite a few times I've put down that this person really needs medication for their whatever condition they can't afford medication for.
Yeah,
I don't know if that has any effect, but I've put it down.
Yeah, no, I just don't think, again, the adjudicators, what they're doing is they're requesting medical records. They're really busy. Look, I've got a case right now I'm working on, where I had a client who had a liver transplant, had it a couple months ago. And the listing says specifically, I think it's listing 9, says that disability is assumed for 1 year following the liver transplant.
Yes,
right?
Correct.
So she had a liver transplant, and they're taking their time getting the medical record. I wrote the adjudicator. I said, my client had a liver transplant. Will you please expedite this case? Again, you can't get them on the phone. It's just really frustrating. And people really suffer because of it. But I don't know, there's no great answer to this. It's just, as I said many times, in the disability world, there's no lobby for people who are lobbying Congress for Social Security disability. We had a friend in Commissioner O'Malley who was there for about 6 months.
That's not quite true.
Okay.
There was a group that lobbied effectively. And that's the group that lobbied for people with amyotrophic lateral sclerosis,
Right. Okay.
also known as Lou Gehrig's disease.
Right.
They got special treatment for people with that condition.
Yep. No 5-month waiting period. Yeah. So if you have ALS, there's no 5-month waiting period. That was one thing specifically. But yeah, there is a presumption. And again, though, diseases like that are part of the compassionate allowance section anyway, but they got rid of the 5-month waiting period. There's like 2 conditions where there's no waiting period. But that is correct. I stand corrected on that. When I talk about lobbying, I mean kind of in general, like you have the AARP lobbies for seniors in general. But my point is, there's no overall lobby for disability to really pressure Congress to fund the agency, or to provide more resources for disability adjudication, or to modify the system to address some of the unfair elements to it. But you are absolutely correct.
Disabled people could lobby if they put their minds to it. After all, they're not spending all day at work.
Yep. Well, I think that's a very good point. And one of the things that I recommend that my clients do is, if you've been waiting for more than 5 or 6 months, I think before that you can't really expect much to happen. But if you've been waiting for 5 months, reach out to your elected representative, reach out to your congressperson, U.S., not your local, reach out to your U.S. senator and ask for what they call congressional inquiry. And that's basically where the senator or the representative would contact Social Security on your behalf and say, what's the status of this case? That is the one thing that will move your case to the front of the line. And they
Have
do.
you ever had a client who did that?
Oh, yeah. Yes, absolutely. And I see the congressional inquiry in the file, and it's stamped expedited. Now, again, I don't tell people to do that a month after they filed an application. Again, in the old days, an application would be evaluated in about 3 to 5 months. That was pretty typical. Now, again, it's 8, 9, 10, 12 months. So I think once it goes beyond 5 or 6 months, I think it's appropriate to reach out to your representative. But I've told people to do that. I see that frequently. And again, it is marked very clearly expedited. And I've talked to adjudicators, and I've talked to people that are senior, the managers, and they will acknowledge that, they get a congressional inquiry, that's going to get special attention. Now, there is something out there called dire need. And dire need is where you tell Social Security, I'm about to lose my house, my car, I'm about to be homeless, get an expedited decision or expedited hearing. I think so many people have done that, and the system is so clogged up, I don't think it really does much anymore. For example, with dire need, you're saying my about to be foreclosed. Well, by the time they get to it and schedule a hearing, which will be 5 or 6 months out, the foreclosure may have already gone through. So to me, the best way to go to try to expedite things, if you're 100% disabled vet, you get to the front of the line, or if you have a congressional inquiry, that can get you to the front of the line as well. But it's a very, very tough road to go. And
That's
I tell
good to
people,
know. I just made a note of that congressional inquiry.
yeah, just there is. In fact, if you look on the websites of most senators or representatives, they will say, do you need help with a federal agency? And you will put in there, and they will ask you to sign a release, and then they will reach out. And they typically, senators in particular, will have somebody on staff who deals with Social Security in particular. And they are usually pretty good about reaching out because, again, you're a constituent, you're a voter, you've got a family, presumably, and so they want to try to make you happy. And they're not going to, they can't put their finger on the scale to get an approval, but they can try to get you a decision. So, yeah, that is something that certainly can be done. Again, it's you're working within a system that is, it's barely chugging along because it's so backlogged. And it's such there's just not enough people, and they don't have the funding, and it's a real mess. So you just have to, unfortunately, there's nothing I can tell somebody when somebody calls me up and says, I'm living with a roommate who wants me out next week. What can I do? I wish I had an answer. I just don't. It's one of the real frustrating things about this. That a lot of times when people do get their award, it's 2.5 years later and they get $50,000, $60,000, $70,000. That's great, but they've suffered for that 2 years. They've really suffered, and it's a real difficult road. It's really not good, not good. What are some of the questions I know on your channel? You obviously see a lot of people commenting. What type of questions do you get? If there's anything in particular.
The most common question I get, and it's kind of frustrating, is people will say, I have diagnosis X. Will I qualify for disability? And I just made a video about that. And the answer in most cases is, I can't tell you because you haven't mentioned how your condition limits your ability to work. Remember, in most cases, disability does not depend on your diagnosis. It depends on how your work-related abilities are limited. There are a few conditions, you already mentioned one,
Yep.
liver transplant, where the diagnosis will get you disability automatically. But in most circumstances, it's how is your ability to work limited.
And I would tell you this, even if you look at the listings, and again, with very limited exception, like a heart transplant, liver transplant, something like that, even the listings, there's typically a section C of a listing that talks about the functional issues, the functional limitations. So even a listing level condition, you need to show functional limitations. because that is really the issue in a disability case. And, one of the things that I like to tell the story is when I started doing this many, many years ago, I didn't quite get that it was about functional limitations. And I went into a hearing with a judge who's since passed away, great, great man, very, very nice guy. And he, I presented my case really focusing on the medical, and he said, counselor, would you stay afterwards? I want to talk to you. And of course, that felt like I was being called to the principal's office, which brought back some bad memories from school, but we'll leave that for another day. But he said to me, he's like, you're prepared, but you're missing the point here. This is about functional issues. And if you can prove that your client's capacity to do various functions that are necessary for work, that those have been reduced or eroded by their medical condition, you win. But if you just talk about the medical condition, I can see they've got a diagnosis. I want to hear from the client what that means as a practical matter. I want to see in the medical record what that means as a practical matter. That's what you got to really focus on, because if you don't, you're really missing the entire point of all this. And Social Security is not real good about telling you that. And again, that's why I do what I do, because I'm really, in many cases, what I do is translate specific medical issues into work limitations, because that's really what you got to have, it's
I'd say one of the more common things that I see that flat out, hands down, meets a listing. That if you have severe loss of use of both legs or both arms or one leg and one arm, you meet a listing. I get people who either cannot stand at all because of leg problems, or can walk maybe 1 or 2 steps maximum because of leg problems. And if that's the case, I always put in my report, this patient cannot stand at all, or this patient can only take 1 step.
Well, I see, and again, to add a question to that, I sometimes see in these consultative reports, the person had trouble getting off the exam table, or the person was not able to, get their shoes back on. I assume you're making note of that sort of thing as well, because of the functional implications there. If they're having trouble getting off the exam table and they need help, that's going to be a real problem.
If they have trouble sitting down, if they have trouble rising from a chair, if they have trouble lying down on the exam table, and if they have trouble getting back up, I make a note of that and of how severe their trouble is.
Yeah. Do you use any sort of a checklist? I mean, is this something where you sort of have this kind of in your head, or is there a checklist type of thing you use? Or and if so, did you develop it as something Social Security gave you?
No, there is no checklist. I just sort of came up with this on my own, and I've been doing it enough that I sort of have it in my head. I've stopped counting, but I've done well over 1,000 individual exams.
Let me ask you about some specific conditions, because again, some of these come up with my clients. One that's always troublesome for me is, well, I'll talk about a couple that are, but one of them is seizure disorder. That seems to be a really difficult type of condition to properly evaluate. Why is that?
Because a patient doesn't seize in the office.
Okay.
I recently had a person I think will be approved for seizures. What Social Security wants to know is, first of all, what type of seizures, how frequently they are they well controlled by medication or not? And if the person is prescribed a medication, are they taking it or not? If they have seizures and they're prescribed a medication and they don't take it, they're unlikely to be approved. I had a person who had frequent seizures, several a week, where they went unconscious. They had tried several different seizure medications. They were on a seizure medication, and it really wasn't doing them any good. They continued to have 2, 3, 4 seizures a week, where they would all of a sudden, without warning, go unconscious, shake and jerk, and then gradually wake up again. It's hard to imagine how someone like that could hold a job.
Yep. But yet seizure cases are really, really hard, because like you said, many times they don't have a seizure in where the doctor can see it. Now, their treating doctor may put some sort of a monitor on them to kind of check the brain activity, but it's very hard to prove.
This is one situation where having a family member or significant other come in with the patient can really help if they've observed the seizures, because usually people are unconscious with seizures and don't know what they do.
Okay. Let me ask about a couple other things, and I really appreciate your time, and I'm going to let you go in a couple minutes because I don't want to take up your entire evening here. Another condition that people get that are really difficult for folks to deal with is fibromyalgia. It's a condition that obviously is, you tell me, but it's a diagnosis of exclusion, I'm guessing, as opposed to one where you can't really test for it. How do you evaluate somebody who's alleging disability based on fibromyalgia?
Well, I've actually done a video on this, and people might want to go to my channel and just type in fibromyalgia in the search region, and you'll get my video on fibromyalgia. Diagnosis of exclusion means that you look for every other possible cause and don't find them. There are no lab tests or x-rays or MRIs that will be positive in a case of fibromyalgia. Fibromyalgia is diagnosed based on the person's symptoms and by finding tender spots in certain areas of the body. And I've included a link to the chart where you check for tenderness in my video. It is possible, there is in Social Security's website, there's criteria for fibromyalgia, but it has to be severe, and it has to severely limit the ability to work.
I think that one of the issues that, I've noticed over the years is that, a family doctor is probably not the person to diagnose. You almost need a rheumatologist, generally speaking, for a judge to find it severely limiting. And, and I'm not sure if they still use this, but at one point, the American College of Rheumatology had a definition of fibromyalgia in terms of the tender points and things like that.
Yes, that's what Social Security uses.
Yeah, so it's got to be quite severe, and it's got to be very limiting. And actually, the profile that I would normally see would be a female, usually 40, 45 plus, type A personality who had done work at a very stressful level. It almost seems like almost like a stress reaction. I don't know if what they know why people have the pain, but I've seen all kind of things
Nobody knows.
Nobody really knows, but it's the people who really have it know it, and they've really they struggle like the dickens to get an answer, but it's very hard to do. But it's the problem is I think it got overdiagnosed over the years, and people hear it, their family doctor says you've got fibromyalgia, then they kind of latch onto that, where it's a really very specific type of diagnosis, but it needs, in my opinion, a rheumatologist, a specialist, to really firmly diagnose it, because otherwise it's too nebulous. You can't, Social Security really thrives on objective tests. You can't take an MRI to see fibromyalgia, can't take an x-ray, so it's going to be really hard to win with those cases.
Well, you've made two good points. The first is a longitudinal, multiple visits to your family doctor is very helpful evidence. But the second is Social Security does like specialist opinions.
Yep.
So the ideal case would be somebody who's seen one doctor repeatedly over several years for their problem and has also gotten a specialist's opinion that supports what their family doctor has diagnosed and done.
Yeah. I think that really, anytime you can get a specialist, no matter what your underlying problem is, if it's back pain, an orthopedist or a neurosurgeon, neurologist, would be very helpful. Relying on a family doctor for a disability case, it's difficult, not impossible, but there seems to be a sense amongst judges that if you really are have significant symptoms, you should be seeing a specialist. Obviously, people can't always afford that, but there seems to be a little bit of a bias against just a family doctor treating you. That's been at least my experience with Social Security.
If you can arrange it, get a specialist's opinion.
Yeah. All right, a couple more conditions I want to ask you about, then I'll let you go. Again, really greatly appreciate this. Lupus is another condition that is, it varies in terms of intensity, can be difficult to firmly diagnose. How do you see lupus cases?
The majority of people I see who think they have lupus don't. On the
Okay.
other hand, lupus can be an extremely severe, even fatal disease, and I definitely see people who do have it. Where the confusion comes in is in the blood tests for lupus.
Hmm. Okay.
And this is one sort of area where it's probably best not to have your family doctor make the diagnosis. You probably should have a rheumatologist who knows about and understands and can interpret the multiple blood tests you require for a correct diagnosis of lupus.
Speaking of that, there's a blood test. I'm blanking on the name. It's not RH. There's some sort of maybe for an inflammation, a blood test.
ANA, anti-nuclear
That's it.
antibody. The
Tell me about
problem
what.
with anti-nuclear antibody is it's positive in 10 to 20% of normal adults.
Okay.
So what happens is a person has aches and pains, they go to their doctor does an anti-nuclear antibody, it comes back positive, and they're told you have lupus when they don't have lupus.
Okay. Because we do see that a good bit, and again, I would caution you that a doctor says you have a positive ANA test or you have a positive test for this. That's part of the picture. There's the symptoms and the underlying diagnosis and the ongoing treatment record are going to be more important, certainly to a judge, because it gets back to you don't win a case because of a diagnosis or a blood test. Let me ask you about.
And there can be mild lupus, moderate
Yep.
lupus, medium lupus, or extremely severe
Yep.
lupus. So it's going to depend on how severe the disease is and how much it limits the ability to work.
Yeah, I mean, this goes back probably 25 plus years. I had a client who was in her 20s who died, who actually had lupus, and she passed away. It was so significant, so severe that it killed her. That's pretty rare, but it can happen. So that's
It
exactly the
happens.
point. Yeah.
It can be a terrible disease.
Yep. All right, and final condition, and again, if you have any more you want to talk about, certainly feel free. Diabetes. I see a lot of cases, a lot of people with diabetes. It is unfortunately a very, very common malady out there. A lot of people have it, I guess, because of poor eating habits or, maybe environmental toxins and things like that. But again, like lupus, diabetes can be, you know, it can be a really significant problem in terms of the organ damage or in terms of neuropathy, retinopathy, or it can be fairly mild. How do you look at how do you analyze a diabetic?
Well, again, I've done a video on diabetes, and people might want to go to my channel and search for diabetes. It's rare that diabetes alone will qualify for disability. There are some problems related to diabetes alone, such as diabetic ketoacidosis or non-ketotic hyperosmolar state, where the person becomes extremely ill, has to be treated in the intensive care unit, sometimes multiple times. It's usually complications of diabetes. Diabetes predisposes people to heart attack, to stroke, to kidney failure, to neuropathy, where their legs go numb and have painful tingling. It can cause all sorts of problems, digestive problems, where the person vomits every time they try to eat. And those are usually the issues that make it difficult for a person to work, not the elevated blood sugar per se. Those conditions usually start to develop after the diabetes has been present for 5 to 10 years. And a significant thing is they get worse with time. So, for example, if somebody applies and is denied, they might want to consider reapplying a year or two down the line because you can just about guarantee that their disabling problems will have worsened in that period of time.
Yep.
You mentioned eye. Diabetes can cause poor vision or even blindness as
Right.
well.
Right now, I have a family member who is blind in one eye. He's been diabetic for many years, and finally, because I think it affects the small blood vessels in the back of the eye, and the capillaries, whatever, and then it just he calls it burning it out, but it just it just destroyed his vision. Now can't drive, can't do a lot of things. Older gentleman, but still, it's a real issue. I think the diabetes, because what I see a lot of times is someone will have diabetes, their blood sugar is out of control 3, 4, 5 years, they don't really have any specific major problems. They may have some fatigue, may have excessive urination, but after 4, 5, 6 years of being, in 300, 400 blood sugar level, it starts to eat away at organs. It starts to affect body systems.
Yes, and it's progressive.
Yep. And you can't really undo it. I mean, once it happens,
right, it doesn't go away.
It doesn't go
just
away.
Gets worse.
And it's also interesting to me. A lot of doctors will put the person on, a medication as opposed to insulin. I guess, maybe because I don't know if it's insurance issues or whatever, but it seems like there's a hesitation to put somebody on insulin, and to try to control it with pills and diet. Although, a lot of times it doesn't.
Patients don't like having to give themselves shots and check their blood sugar.
Yep.
And there are certain risks and dangers of insulin. So not everyone with diabetes should be on insulin.
Got it. Okay. Well, I just put a link to your YouTube channel in the comments section. Anything, and again, I'm going to keep this open a little bit longer. I'm going to answer a few questions that have come along that are just more general. But any other comments you'd like to make about the role of a consultative doctor, what people need to be aware of before I let you go?
I just like to repeat. If you're scheduled for a CE exam, what you want to do is describe your problems and how they limit your ability to work in your own words. And then just be honest, do your best during the exam, and you'll have your best shot at getting your disability application approved.
Yep, I think that's very, very good advice. All right, Dr. Foster, I really appreciate it. And I'm going to stay on for those who want to continue. I really appreciate your time and your expertise and your knowledge. Very, very helpful. Thank you.
Thank you, Mr. Ginsberg. It's been my pleasure.
You got it. Okay, I'm going to go ahead and take you out of the room here, as it were, and I'll continue to answer questions, and we'll hopefully talk again soon.
Okay, take care.
Bye-bye. Okay, well, that was very insightful. I hope you all got as much out of that as me. Dr. Foster, again, if you've not seen his his YouTube channel, it is at YouTube at the @ Disability Exams. Disability Exams. He gives a lot of information, and again, what he told me was that before he, when he started doing this, the channel was originally to help other doctors understand how to do exams properly, and it kind of grew because people saw it, and folks like us started watching and ask questions, and so he goes through a lot of detail. Check it out. He's got 154 videos. A couple of them are not about CEs, or about, I think he's got, as he's got some dogs because they were barking a little bit, but take a look at that and you can learn a lot about that. And again, this is one of these things where most cases you're going to see the consultative evaluations, and this is a good way to prepare for them. Okay, so let me go back, and I'm going to stay on for a few more minutes, just answering a few more questions that people have asked here. Some of these folks may not be on anymore because it's been a little while. Okay, so this is a good question. I was approved on my initial application last week, but the onset date got changed. They changed it from April of 2003 to April of 2024. Is appealing an onset date a wise move? It really depends. I have just appealed a couple of changed onset dates in my own cases. I've also got a couple where they changed it by 3 or 4 months, and I told my client, don't appeal it. A year, you theoretically, and again, I'm assuming that there's no issue with the 5-month waiting period and all that stuff, but that would be a year, potentially a year of past due benefits. If your benefit amount is $2,000 a month, that's not insignificant, $24,000. Sometimes they change it based on your age category. If you turn 49 to 50 or 54 to 55, and you meet the grid rule. My overall observation is that if they're willing to approve you early, it's not a huge risk to appeal it, because what is a judge going to do? Turn you down when you've been approved by the state agency early? It is a slight risk. Normally they start paying you, so you're getting paid. The risk would be that a judge finds you not disabled at all. Now you've been overpaid and they want their money back. That's the risk. I think if it's $5,000, $7,000, probably not. $20,000 might be something to look at. So I think that, what I would look at here would be the reason why they changed it. Is it something specific? Was it an age category change? Was it because of a surgery or some change in your medical status? And if you've got an attorney, talk to your attorney about what are the risks here? Is it possible that, I may get denied entirely, or is the risk pretty minimal? And you have to make that decision. That's really what you got to really think about. Hey, Rodney, and again, it's been a while. I know Rodney actually came by the office the other day to pick up his CD. I'm sorry I wasn't there, but I'm glad you got the CD back. Okay. Let's just go through some of these. Thank you, Kelly. I appreciate that. Yes, it was really neat to have the good doctor with me. That was great. Dr. Foster really knows. I'm trying to line up I think I have a retired disability judge, which will be next year. We're trying to firm up the date, but this is a judge that's now retired. We emailed back and forth yesterday, and I said, would you come on my live stream? He was like, yeah. So he'll be a really great resource to answer questions. Again, I think you're going to get the same information that you've gotten from Dr. Foster and myself. Is you want to focus on the limitations, but I know a lot of people say, here's my case. What do you think? And who better than a judge to tell you? Let's see. Vince says hello. Vince is a regular. I appreciate that. Trish said hello. Thank you, Trish. Okay. Eric says, I haven't worked for a year and a half, been on the Medicaid, possibly the best health insurance on the planet. Does that have to be repaid in the future? No. I mean, if you're on Medicaid, you wouldn't have to, they don't make you repay anything. So no, I think that you're good on that. Shannon is a regular from Budapest, Hungary. I think she said it's the morning there. So good morning, Shannon. Christina, another regular. Hello from California. L, another regular. Question: a recently approved friend says his approval came with a 2-year reevaluation. Can that option rescind the approval? No, it's not going to rescind it. It just means that Social Security, the judge said, I think this is a likely situation where you might have improvement. So I'm instructing Social Security to reevaluate you in 2 years. So you want to keep going to the doctor and be prepared in 2 years to have somebody look at it again. That's all that really means. Okay, Tim, this is about the consultatives, and as Dr. Foster said, that's not sufficient. I don't think. Okay, Soumya, appreciate that very much. Okay, and as far as a psych, James, and again, Dr. Foster is not a psych consult. Maybe I can try to get a psychologist on to talk about the psych consults. How do you prepare? I don't think you really prepare for the psych consult. I mean, unlike a medical exam where you sort of have to talk about your limitations, you want to think about the issues that concern you psychologically, whether it's severe depression, and be able to talk about how frequently you have symptoms, anxiety, what that means, PTSD, what the triggers are. But a lot of the tests they give you are just to evaluate the extent of it. I think the same principles hold true. Is you want to focus on those elements of your psychological condition that would be work preclusive. And again, I'll take PTSD as an example. If you have flashbacks because of with loud noises or with lights or with a male voice or with a siren or with a car backfire. Those would be the things you'd want to talk about. If you have episodes of depression where you're bedridden for, 2 days every 2 weeks, you want to quantify that as much as you possibly can. What does it mean? A question I always ask at a hearing: what does it mean to have severe anxiety, severe depression? How would you describe it? And a lot of people say, well, it's like, imagine you're in a deep hole, you see a pinprick of light above you, and you're struggling to get out. You have no motivation to do anything. You can't get out of bed. You don't want to eat. You don't want to interact with anybody. You want to be able to describe it. You don't want to say, it's hard to describe. You want to be able to talk about what it means. If you're trying to describe depression, anxiety, PTSD to somebody who doesn't have it, how would you talk about it? And jot down some notes. That's what I would say. Okay, so L makes the point of spine, back is, and again, most doctors will talk about the spine as opposed to the back. But again, we call it back. Which of the 6 steps? I don't understand. There's a 5-step sequential evaluation process. So this is going to really be part of the overall evaluation, a consultative about, your functional capacity. SSA says I could have adjusted to other work at the same time. SSI's determination of severe results in a finding of just about a good place to appeal in SSDI. Probably. If SSI, it's the same people making the determination. So yeah, I think that you would. Okay. Somebody made comments about Dr. Foster's dog. The dog was barking. I'm not sure what kind of dog it is. If you look at his channel, he's got, I think it's maybe a Shih Tzu, I don't know, a little dog. I had a little poodle once, 16 years he lasted, Joey. And he was a yapper, little dogs yap. Now Sadie, my 75-pound golden doodle is not much of a yapper, but when she hears something, woof, deep woof, it's pretty loud. So, okay. Okay, well, yeah, dogs are going to make their presence known. Okay, so I think he gave the dog some treats or whatever, but I think Mr. Gumball said the dog's angry about the time his disability case was in reconsideration. Very, very true. Okay. Addison's disease. I think President Kennedy had Addison's disease. Again, it can cause significant problems in terms of your functioning. So it's not the diagnosis. It's what does it mean in terms of your functioning specifically. Okay. Let me just put this little banner up there here about leaving reviews. So if you do enjoy this, if you found this helpful, please leave me a review. Would really be appreciative. Okay. Okay. So Alan asks, let's see this. I think we skipped a few here. Okay. Let's go back here. Okay. So this person said that when the CD doctor did review his MRIs. So again, I think every doctor's got their own way of doing it. Dr. Foster does not. Warren got a verbal approval. Website still stage 3. How long official notice? 2 months is a long time, Warren. I would reach out to either your attorney, or if you're not represented, contact your congressperson. If you got a verbal approval and you've been waiting 2 months, that's too long. That's too long. Alan's going to be 61, terrified to lose your mind in your job. I hear you. If you're still working, though, obviously you can't pursue disability. Okay, this is a very good question. What if you're working, but you're reporting your earnings, you're not making that much, but you're reporting your earnings and you're pushing yourself because you got to eat? Yeah, eating can be a motivating factor, no question about it. I would say if you're under SGA, which remember is $1,550 in 2024, and I think it's $1,620 2025, you're okay. But if you're over that, Social Security says you're working. 18 grand a year, 19 grand a year. You can't pursue disability, so it makes it really, really hard. Is short-term disability, if they fire you, if you have short-term disability through your job? Yes, it is. Usually it's pretty easy to get. Long-term is what becomes a problem. And again, Alan, the problem you're talking about is the problem that I see all the time, and that is How do you survive for 2 years waiting for Social Security to do its thing, or for long-term disability to make a decision? The long delays can leave you homeless, literally. Literally homeless. Okay. Mr. Gumballs went to a doctor, a social security doctor, and they said that the office was a mill. They felt like you're in a prison infirmary. Yeah, I hear that. And again, some doctors, do this and they try to get as many people through as they possibly can. And, it can be a problem. I think we already talked about that one. Okay, Elle brings a good point. Warren's asking about, got a verbal approval. You still need to get a written approval, but she makes a good point. Make sure they've got your bank information. Make sure you've got that. And Warren says, yes, the website still is waiting for a hearing. And I will tell you, sometimes Social Security changes its mind, but I think I would contact your congressperson to get an answer to that. Okay, Christina says, please like, share. Thank you, Troy, for liking. I appreciate that. And again, the positive reviews are really, really helpful. Kevin can go 2 miles around the block. 2 miles that's a big block. Both knees swell up. Well, again, then you're not, I think that to say you can go 2 miles is not accurate. How long can you go without terrible swelling? That's probably more accurate. If you had to do it day after day after day, I don't think 2 miles is really very likely. Okay. Salim says, I have bilateral facial palsy, rare condition, face brain injury, chronic migraine, 55. I would tell you, Salim, what are the issues? What are the practical problems? So, does it affect your talking? Does it affect your eating? You can't get nutrition. Does it affect your, again, I talked about speaking and being understood. Does a brain injury, you mentioned the migraines, how bad are they? How frequently do they have them? Can you quantify that? It's not about the condition. It's about the effect. Same here, Kevin. Disc bulge doesn't tell me anything. What does it mean? What does it mean? Practical. Bell's palsy, again, what does that mean? It's going to limit you from jobs that you have to maybe speak if it's going to affect your speaking. But, a person with Bell's palsy could do a simple sit-down packing job. And so you got to go beyond just the diagnosis. Okay. Good question, James. If SSA says you can adjust to other work, does working part-time office job at home affect your chances of volunteer position? It could. Again, they're going to want to know what you did, how long you do it for. That could absolutely affect your chances, because they may say that's substantial gainful activity and is evidence of your capacity to work. Charity talks about, is it legal if the doctor asks if you're seeing in person, if the report talks about you're being seen in person when you're in fact being seen by telehealth? That's inaccurate. That would be something that you could certainly bring up to the adjudicator, or your attorney could bring up to the judge that was incorrect. And just like a claimant who exaggerates or misleads about, point A, if a doctor misleads about point A, then everything that person says is called into question. So yeah, I think you could certainly raise that issue. That would, if the CE is not going to help you, the report is against you, then yeah, that would be something to challenge it. Maryland SSA, I don't understand the question. Okay, great, thank you, Julie. I'm glad that this was helpful to you. I'll put this banner back on. And if you'd like a case evaluation, that's where you can do it. Okay. Glenn watches us every week. Great. You know what? The more you know, the better. The more you know, the better. I have no health insurance. How do you go to the doctor? It's a problem, because Social Security says if you're not going to the doctor, they assume there's nothing wrong with you. But of course, if you can't afford to go to the doctor, there's no answer to that question. I just don't have an answer for you. It's a real problem. Sharon, how can you discern? Sharon, a little feisty, asking questions about challenging the doctor on that. Again, his answer, I think we talked to this before, is he's taking a snapshot based on what he sees in front of him. Mental status exam is basically a consultative evaluation for mental health issues. Same like a consultative physical, but it's by a psychologist. Hello, Tara. How are you doing? Okay. Okay. Um, CE, what about Bob? Says CE doctor makes employees of insurance company try to deny you vocational experts cite jobs like machine. I don't agree with that. I think that some CE doctors are, they work for industrial clinics and they work for insurance companies, and their goal is to get you denied, no question. Others are just trying to make a little extra money, and they're just trying to do something, just objective. I personally find that psychological consultatives tend to be a little more, you know, consistent in their objectivity. The physical consultative exams, most, there are some doctors have an agenda, some that don't. It's just going to depend. But you're probably more likely to find that with physical consultatives than you would with mental health. I would agree. Okay. Let's go for just another couple minutes. Let's see here. That's me. Okay, no way. Sorry, he's wrong. Workhorse my whole life. Grew on a farm. You worked him out. If you can't, you look weak. Okay, Marissa, I think what he was getting at, and I'll say the same thing, is when you're appearing at a Social Security consultative evaluation, or for that matter, your own doctor, think about your functionality on an ongoing basis at a job on an average to bad day. Not the worst day possible, but not the best day. On a scale of 1 to 10, a 4, 3.5 to 4. You can't be a hero. I mean, you've got to think about, could you do a job? You're trying to prove that you can't perform reliably at a job. So if you've got this incredible work ethic, that's great, but you're not going to win your disability case if you tell them and the evidence indicates you can do things and you're willing to handle a high level of pain doing it, then you're not disabled, because working is evidence of not being disabled. So I think that you have to just make a decision about how you're going to pursue this, and whether you want to or not. Okay. He's discounting pain. My feeling is that pain is one of these things that's obviously somewhat subjective. There are people out there who have a very high pain tolerance. Others have a very low pain tolerance. Others become invested in the idea of being disabled because of pain. It's very hard, in my opinion, for a consultative doctor on a one-time evaluation to make that kind of decision. I think doctors, and Dr. Foster, I think, falls in this category, are skeptical about people who are talking about constant excruciating pain, because they see too many people that are saying that. So yeah, pain is a significant problem, but you've got to, how do you prove you're in pain? And again, it's going to be by reporting to your doctor on an ongoing basis, that longitudinal treatment record, not the one-time visit, the medications, the treatment. You have to sometimes ferret it out. You've got to be able to sort of, find evidence of pain by the conduct of the doctors and the claimants, is how I would put that. Okay. Let's see here. Let's go with a couple more. Kelly, I've applied for SSDI because I have a cervical degenerative disc disease and my issue doing repetitive movements, burning pain. Yeah, I mean, and again, there are some jobs that require repetitive movements, other jobs that don't. So would you be able to do a job that required you to use, to trigger your shoulder and your neck, a third of the day, what they call occasionally? Could you do that? I don't know. That's what you have to, and, depending on how old you are you over 55? The grid rules could come into play. But realize that for Social Security, in general, if you're under 50, you got to prove you can't do any kind of work at all. So let's take out the repetitive motion jobs. A lot of jobs out there that are not repetitive motion. Could you do one of those? Okay. And I think somebody said, L says, degenerative disc disease, spondylosis, is common. So you look right, absolutely correct. Mild, moderate, or severe. Okay, it said severe. Okay. Okay, so Uncle Bob says that the CE doctor's report helped get him approved. That's very helpful. That's good to know. Okay. Hello, Sherry. Nice to meet you as well. If you never worked a W-2 job, well, first of all, if you've worked 1099 jobs and you pay taxes, you may have insurance credits. If you're not sure how to find out, go to ssa.gov/myaccount to see whether you have enough credits. If you don't have enough credits for SSDI, you could apply for SSI. SSI is means tested, meaning assets, household income would disqualify you, but it is, and it's not very much money. It's going to be like $1,000 a month, but it's better than nothing. Okay. Let's see here. All right, I'm going to take a couple more questions and I'm going to be done here because I've got a few things I got to do this evening for the wife. Okay. Passive J. What happens if your hospital records are deleted? Should you mention it? Yeah, it may be referenced elsewhere, but I think if it's been deleted by the hospital, you could still talk about it. A judge would decide how much weight to give it, but yeah, you definitely can. Okay. Charity says, I saw a neurologist at the Mayo specialized in headaches, but I want to address my 18 years of headaches due to being referred for memory and SSD. My memory is great, never touched me. Yeah, I don't. Normally at the Mayo, they're doing more of a comprehensive type of thing. I can't answer that why the doctor did not talk about headaches. I mean, there are headache doctors, specialists in headaches, but it's unusual that the Mayo would not do that. But again, I can't really explain why. Don't really know. All right, we'll leave it at this. Thomas says, always get a lawyer at recon. Tried to do myself in for meeting on the blue conditions and lost. I'll leave it with this. At initial, about 35% of applications are approved. Usually they're listing level, very severe. Recon, people that appeal, that are denied at initial, they appeal to recon. About 14% of those people are approved, very low. The ones that go to a hearing, it's 45% round numbers. If you're over 50, it's going to be higher than that. So as a practical matter, most people aren't going to get approved at recon. If you have a case that could be approved at recon, at least speaking for myself, I will identify that. I'll try to reach out to the adjudicator and try to get you approved at recon. But it's probably not going to get approved at recon. It's going to go to a hearing. So there's no reason not to get an attorney at that early stage because, if you don't have an attorney, you're not going to get approved. If you do, you probably won't, but you might. So I don't disagree. But on the other hand, I would also tell you, I don't get offended when somebody says, I want to do this as much as I can myself to avoid giving up my past due benefits. Absolutely understandable. I wouldn't go to a hearing without a lawyer. I'll leave it at that. But, initial and recon, it's not really harmful to do it yourself. But I don't think it's a mistake to get a lawyer, early on either. So, all right. So let's leave it at that. Again, I thank Dr. Foster very much for his time. And I hope you guys got something out of this as well. Next week will be the day before Thanksgiving. So we may do an abbreviated live stream, but I plan on being here. So again, as always, send me your questions, leave me your comments. Thank you very much for attending. And if those of you who do not appear next week, I hope you have a great, healthy, happy Thanksgiving. And we will hopefully see you all again very, very soon. So for now, this is Jonathan Ginsberg, and I'm wishing you all the best. Thanks a lot.